DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. Thanks for joining us today. Today we're going to have a great show. We have Dr. Steve Ensley from Kansas State University's Veterinary Diagnostic Lab, where he leads the toxicology section. Today we're going to talk about blue-green algae, so stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, welcome to DocTalk, and we have a familiar face, the Onega, Kansas native, Dr. Steve Ensley. We're back at Kansas State University, here where Dr. Ensley serves as a toxicology professor and does a lot of service work too, right, in the diagnostic lab?
Right, the more I can do, the better. So
right.
That's what I enjoy.
And so, Dr. Ensley comes with a world of knowledge. He has been in private practice, and I think that's what your practical understanding of everyday what farmers, ranchers, veterinarians are going through just helps you serve people so much better.
Yeah, no, yeah, my practice experience I think is invaluable. My dad was a veterinarian. I'm only a 2-generation veterinarian, not a 3 like Dan is. But yeah, I learned a lot from my dad, and then the practice time I had was really where I learned everything. And then, you know, when I came back to school, I get to apply what I learned there. But yeah, being able to practice is, you know, I think is a must if you're going to be trying to do anything like I'm doing. So.
Yep. So you're seeing samples every day. You get people sending you in things, and you get all the fun cases.
Right. Yeah, I'd say, you know, when I was in practice, I, you know, looked at infectious disease things are probably 80% at least of what we look at, but the tox cases are 10%, 15%, but they're clearly the most fun. You know, I mean, that's when you have all the death loss associated with some of the, you know, big cases. So yeah, usually, yeah, I always say if anybody knows me on a first name basis, it's probably not good for them because they had too much trouble. But
so we're going to talk about blue-green algae, and pretty common.
Right. So I'd say, yeah, blue-green algae's been around forever, but been a big change in the last 10 or 15 years where the blooms are bigger, they're more repeatable. We just have more issues with blue-green algae that don't go away. I was at the Diagnostic Lab at Iowa State for 16 years, and when I was there, we had blue-green algae problems that you know would be a problem every year, and we, you know, it used to be you'd have problems one year, maybe not the second, but now it's if you've had problems one year, you're going to have problems again. It's just a matter of when. So
it's the same ponds, the same reservoirs, the same things catching it wind up being repeat offenders.
Right. So it used to be in small ponds, in our pasture ponds, it wasn't as repeatable, and it wasn't, you know, as big a problem. Now, I remember by Osceola, Iowa, there was a place that we had cattle death loss with, I think every year for the last 5 years. And, so trying to make a change, we have to do something different, or the problem is not going to go away.
So I think that's a great setup for what you're going to see in the next 3 sections. As we talk more about blue-green algae, we'll talk about what it causes, some of the clinical signs, and then some of the things we can do for it. You're watching DocTalk. We're here with Dr. Steve Ensley at Kansas State University, and we'll be right back.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertis test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Steve Ensley, and we're at Kansas State University, where Dr. Ensley serves as the lead of the toxicology section here at the Veterinary Diagnostic Lab at the College of Veterinary Medicine at Kansas State University. And we just switched. I'm an Iowa native that taught down here for years, and you're a Kansas native that taught at Iowa State for years, and I'm going to say Iowa State got the short end of the stick by getting me back and you leaving.
No, I don't know. That's all I hear about what Dan Thomson used to do. So.
Yeah, well, I don't know about that either. But it's always fun to get together with Dr. Ensley, just a wealth of knowledge. And so as we talk about this blue-green algae and we talk about, what would people see as far as if all of a sudden I think I have a problem, what would the cows or the bull or the calves be looking like?
So yeah, usually if the water, if your pond water changes color or you notice an abnormal growth, that's the first thing we like to be aware of. Many times it can be vegetation, so it's not always a bloom. So you need to usually have the water tested or do something so you can determine whether it's a bloom or not. If it's a bloom, then we need to test the water to look to see how safe it is, and then if we can't use it, you need to get the animals off of there. But the problem with the blue-green algae, when we have a bloom, these cyanobacteria produce a toxin, and so if they're there and they're producing a toxin, it can get serious. We'll see death loss and illness. And the two syndromes we typically see, one's an acute death. There's a neurotoxin they produce. The other one is liver damage. So the liver damage issue can maybe not show up all at once like the neurotoxin will. But so we see problems with animals on pasture aren't doing well, and if you didn't check your water source out or have any indication that was the problem, you're probably going to miss some of the initial clinical signs that we see with that.
So what do we find? A dead cow, or
Right. Sometimes you see an acutely dead cow, or as you look, you may see wildlife even around the pond that have died.
Really?
Yeah. It's if the neurotoxin is there, it's that sudden. We've had cases where dogs have actually swam across the pond, got to the other side, get out and fall over and die if that neurotoxin is in the pond. So it can be serious. The liver toxin, the good thing is the one we see most often is the liver toxin. And so it can be a little harder to figure out because it damages the liver, but the liver's very regenerative, and so the signs they show can be very variable.
Okay, so is this toxic to people?
Sure, yeah. So yeah, so if you see a bloom, a lot of the issues in the U.S. in the Gulf states are where these blooms occur where people want to be on the water or recreate in the water, and even in Kansas, Milford Lake is probably the poster child for blue-green algae blooms in the Midwest, and Tuttle Creek has issues too. But yeah, so the state will, and the large bodies of water that people go to, they'll monitor those and they'll post those when they see a bloom. So if you see a sign out where you're going to a big lake and there's caution about a bloom, then at least if you're in that vicinity, you want to go back and look at your water because the conditions are probably favorable that you may be having an issue that you didn't realize.
Perfect. All right, we're going to take a break. When we come back, we're going to talk about some of the things you can do to sample, send in samples, get a good diagnosis. We're here with Steve Ensley. We'll be right back.
DNA Dialogue is brought to you by Igenity Beef, powered by Neogen.
The good news about DNA is that once an animal's born, it doesn't change. So when I'm often asked when's the best time to take a TSU sample, my answer is always at your earliest convenience. It's really easy for me on my operation. I take the TSU at birth once that calf is dry, and then I tag the calf right in the same hole that the TSU came out of. Or if it's easier for you, you can do it at weaning, at branding. But the most important thing to know is that it does take time to get those results back. You need to provide ample time to the genetics company so you can get those results back in time to make effective decisions.
One of the most core principles in the beef business is reducing risk. We have eliminated and reduced the risk of animals not performing up to our expectations through the use of EPDs, through the use of genomic testing. I've gravitated toward the Angus GS using it. You've got all the right people in the room when you've got Neogen and AGI working together. That's what puts my confidence in the Angus GS test. Cattle producers have always been sustainable. We have no choice but to be sustainable. But however, this is another tool to identify the most efficient animals, which take less inputs, less resources, and produce more beef with less inputs, less resources than ever before. And I think the evolution of genomic testing is vital to the cattle business.
Angus GS, powered by Neogen, is the highest industry standard in genomic testing for your whole herd. Contact the American Angus Association or your Neogen territory manager to test today.
It's the crews, cattle, and accolades that keep you striving for the best that's ever been. It's more than a banner or a great calf crop. It's everything you deserve. And for that, we're here with all you need. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Steve Ensley, and we're back home. We're at Kansas State University, where had a great career and great time, and got to work with Dr. Ensley more than once in my career, and he's been a good friend and colleague. He's the leader of the toxicology section here at Kansas State at the Veterinary Diagnostic Lab, and just a wealth of knowledge. And if you have toxicology cases, I recommend send them into Kansas State. I haven't found anybody better to work with than Dr. Ensley. And so when if you think you have blue-green algae, how would you go about sampling?
So a couple things. There's a couple quick tests we do where you can take a sample of the water. So you take it on the downwind side, because these blooms will move with the prevailing wind. So don't go to the upwind side, go to the downwind side and collect your sample. Try to get it from as far off of the shore as you can get it, a couple feet at least, and then below the surface of the water, probably an inch. And if you take the water, put it in a bottle and watch it. If the algae, or if that color stays suspended, you know, it may not be a problem if the bloom goes to the bottom, then, you know, that's where we're concerned then. The biggest issue is if you think it's a problem, if you could collect the sample and get it to our lab, we like to look at those and see, because we look for these cyanobacteria that are in there, and if we see those, then we can also measure the toxin. But the most difficult thing can be trying to decide whether, you know, the bloom you have is actually a bloom or vegetation, or, you know, and how fast do we need to get animals off of there. If you don't see a death loss but you see a bloom, you know, trying to sample quickly and trying to get it into the lab so we can look at it is
probably a good idea to go out into the pasture and look at your ponds before kicking animals out in there. Because, you know, we've all had cases where they say, well, I'm running 400 cows and I've got them in all these pastures, but the only cows in this pasture are getting sick, or this pasture are dying.
Right. And a lot of times the water, you know, people, depends on where the water source is. You know, it's usually got to be a body of water, not a tank or a watering device of any kind. Usually we don't have any trouble with those. The surface water is where we see the issue. And so in the summertime in the Midwest, you know, you need to periodically, you know, try to look at the water sources to make sure they're fine.
How much do they send in, and what do they send it in?
So yeah, usually I like a bottle, a quart of water. Typically what I get is whatever's rolling around in the truck when they got there. If there's an empty bottle, you know, pop can, spit can, whatever, you know. So make sure you rinse that out a couple times. You know, try to collect the most accurate sample you can. But yeah, so typically if you're going to sample, you can stop at the quick shop, get a bottle of water, take that out to the pond, dump that out, rinse it a couple times with water from the pond, cap that, cool it, you know, try to send it in a cool container, then get it to the lab.
How long does it take to get results back?
We'll look at them the same day or the next day. Sometimes we have to sit and let those samples settle and then look at them. It's more accurate that way. So, but yeah, no, it's typically we try to get on that as quick as possible, because if it is a problem, we need to know.
Perfect. All right, folks. We're going to take a break here. We'll come back. We'll have a wrap up here on Bluegreen Algae with Dr. Steve Ensley.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Steve Ensley. He's a toxicologist and professor here at Kansas State University at the College of Veterinary Medicine in the Veterinary Diagnostic Lab. And we're talking about blue-green algae, and we've talked about what it is, what it does, how to get samples and get them to you to find out. But now, what if I have a problem? What do I?
Right. I mean, so everybody wants to know, how soon can I have animals on there? What do we do to prevent that? That's what we need to know, and that's unfortunately what we don't. Intervention strategies to prevent it or moderate it or lessen it. We're not. We're looking at a lot of things, but there is no one thing that really works well. In the past, we've used copper sulfate, so a lot of people that have tried to do something, know that was an old treatment that we had, and it works. It'll kill the algae, but in the process of killing the algae, sometimes they'll make the bloom. They'll release more toxin as they die from that. So as it turns out, that hasn't always been good. And we also, because we see that yearly now, if you do that year after year, you'll actually get enough copper in the silt or in the pond that can be an issue, just the copper itself. So the things we try to do is, one of the things is try to, when we have a rain event and it washes the soil or the water into the pond, that's when the issues always occur right after that, typically when the water's warm enough. So anything we can do to increase the buffer strips, increase the filtering of that water before it ever gets to the pond is what we try to work on. If there's crop ground around, try to do something we can do to divert that water away from the pond. So anything we can do to keep nitrogen and phosphorus, from runoff into the pond is what we want to do, because we know that both of those will, aggravate the situation, or that's what the algae like to grow. They like still water, they like warm water, and then they want a rainfall event that brings the food to the water. So if you can interfere with any of those three things, that's what we try to do.
Gotcha. I was amazed. To me, I thought it was kind of a regional problem, but I sat on a board up in Saskatoon, Saskatchewan, and it's a huge issue up even in Canada that
Right.
They're having. Anywhere that there's an interaction between agriculture
Right.
and water seems to be.
Right. In agriculture, we get a lot of the blame,
Right.
but there, in cities and other places where,
True.
nitrogen and phosphorus are used, they contribute just as much as any agricultural enterprise, even though we get the blame for most of it.
Yeah. Well, any parting words on blue-green algae?
No, I wish we had more information, more strategies to try to get rid of it. That's what we try to do. But, as an owner, monitor your water, know what the water supply looks like, because that's, for blue-green algae, that's the key.
Okay. Well, folks, thanks for joining us today. Remember, if you want to know and see what we do at DocTalk, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. And I'm here with Dr. Steve Ensley. I'm Dr. Dan Thomson here at Kansas State University, and we'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, Turn to Suprevo, the fast that lasts. Suprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Suprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
We know how expensive it is to keep and maintain heifers. What is also the fallout of those heifers if they're not the correct ones you're keeping and maintaining? We want to do as much as we can to get it right before we spend the money to impact our herd further down that road and keep successive females out of the wrong type of females.
Identity Beef. Contact your Neogen territory manager to test today.